Welcome. Thanks so much for joining us for today's program. It's great to have you with us. We're pleased to be able to offer a quick update for our members throughout the state of Florida as we address what the end of the executive orders in the state of Florida mean for the delivery of telehealth services. We've had quite a few communications to our offices asking, what the impact is of the governor allowing the executive order to expire recently, and what that means for the provision of telehealth services in the state. So we're extremely pleased to tackle this timely topic today. And we have with us Christopher Acevedo, and Chris is the Chief Operating Officer of Acevedo Consulting, based in Palm Beach County. We've got a great working relationship with their team down there at the consulting services, and they do offer educational programming to our members throughout the year, as well as discounted services for those folks that want to engage them to a larger degree on consulting and other educational needs. So it's great to have Chris with us today. And Chris, we look forward to your comments on this timely topic, and we'll let you take it away and give an update to the membership.
Awesome. Thank you, Fraser. So I know there have been a lot of questions. I've seen them throughout a bunch of the society listservs and listservs for specialty societies. And the information we're going to cover is as current as of right now today. I expect there to be some updates, not necessarily for what we're going to cover specific to Florida, but from a federal perspective, there will be some updates at minimum in the coming weeks, at maximum as the fee schedule for Medicare providers is put out in its proposed form in August, which is just next month. I can't believe we're that close to the end of the year. So we're going to talk about the executive order, what it meant, what the expiration of the executive order meant, and any effect it had on the emergency provisions. Remember that as we talk through anything that was allowed from a billing perspective, right, all billable services have to be medically necessary. They have to be accurately represented by CPT or HCPCS codes submitted to the claims. And there may or may not be some EMR restrictions that were ready or not ready for us to be in a public health emergency with specific locations or code-based bundles. But know that those all would have had to have been medically necessary in the first place to be able to bill any. So what was Executive Order 2052, right? So Governor DeSantis issued on March 9th, 2020, an executive order that declared Florida to be in a state of emergency. It was a 60-day executive order meant to expire on a number of occasions, and quite expectedly, it continued to be extended over 7 separate occasions. However, the last of which expired on June 26th of this year, and it was not extended, has not been extended, nor has there been legislation passed to extend any of the provisions from a Florida legislative perspective. I know there are multiple entities lobbying our legislature during session to come up with special sessions to help ensure that our patients and providers can have their needs meet each other's needs based on the current set of circumstances that we still have some variants in play, and there are still active numbers of cases of COVID-19 hitting the register every day, right? But the executive order by the Florida Governor DeSantis then called for the Florida Surgeon General to issue their emergency order 20-002, which allowed for the following. Right. It allowed healthcare professionals and life support professionals that had a valid license in any state outside of Florida to render services in Florida. It allowed healthcare professionals to serve patients from a telehealth perspective in Florida if they were licensed in other states. It allowed emergency medical training programs. It allowed for half of the instruction that's required to be the prerequisite in order to complete training programs. It allowed for an expansion on the use of medical marijuana through telehealth and otherwise existing qualified patients. It also allowed for renewals of controlled substances previously not allowed through telehealth to be renewed for existing patients for treating chronic non-malignant pain. And it also helped with the suspension of certain rules that limited prescribing, right? So all of these things were laxed in the wake of the Surgeon General's order. And the first question we get all the time since the expiration of the governor's order is, well, does that affect the Surgeon General's orders? And yes, the fact that Executive Order 2052 expired on June 26 means that the Surgeon General order that was in direct correlation to the executive order also expired. So what did that mean? It means that we reverted back to pre-pandemic statutes, right? So it's not as if we were long-term going to be allowed to do anything that we weren't previously doing. And it's not like anything changed back to something we shouldn't have been used to, right? So all we did was revert back to pre-pandemic Florida statutes, which means without a Florida license, you can't serve patients via telehealth in the state of Florida. If you don't have a Florida license, you can't provide face-to-face clinical services that require a license, unless there's some other statutory exception, right? But the exceptions that were made for the provision of services during the public health emergency are no longer allowed, right? So in essence, those first two bullets mean you have to have a Florida license to treat patients either in person or via telehealth, right? Which was the requirement prior to March of 2020. When it comes to emergency medical training, all of those programs have to now provide for their entire educational programming, no more half of the programming. You can't recertify patients for medical marijuana using telehealth. So we now have to have an in-person examination. So that's really one of the first Florida licensed provider pre-pandemic revisions, right? Going back to the state of where we were prior to March of last year that hit us is no more telehealth recertifications for medical marijuana patients, have to be in person. And then when it comes to controlled substances, other than some specific exceptions, which we'll talk about, there's no longer the ability to renew controlled substance prescriptions for existing patients, right, for chronic non-malignant pain via telehealth. Again, all of these restrictions were in place prior to the executive order. And when it comes to the Surgeon General's orders and some of the additional allowances that it called for, right? We also cannot have volunteer healthcare providers providing new medical services to existing patients, right? Without completing Form DH 1032, and it also reverts back to not allowing individuals to just reactivate their license, right, because of a public health emergency and treat patients with expired licenses. Again, those were all components of the statutes that were in place prior to the emergency. Now they're back. So when it comes to the controlled substance piece, that tends to be where the most questions have been coming from, right? What are the rules? Well, again, they're the rules that were in place prior to the public health emergency. So what is it? It's Florida Statute 456.47. and it states that a telehealth provider may only use telehealth to prescribe controlled substance for the treatment of a psychiatric disorder, in treatment of patients at a hospital that's licensed under Chapter 395, patients receiving hospice services, or residents of a nursing home. Right. So this means for all of our ambulatory clinics, if we're not treating a psychiatric disorder, we cannot use telehealth to prescribe controlled substances, just like we couldn't prior to the public health emergency. But we're back to not being able to do that. Right. That's the big, that and the marijuana examination for extending medical marijuana use, right? Those are the two provisions that are directly related to telehealth and the expiration of the governor's executive order and subsequently the Surgeon General's executive order. When it comes to the federal telehealth waivers, so this is our ability for treating Medicare patients, right, through telehealth, as long as there's a medically necessary telehealth visit required or needed by the patient, as long as we're licensed in the state of Florida and we're not renewing prescriptions, right, outside of those four exceptions I previously covered, we can still see patients via telehealth. We can see both new and established patients and bill them with the respective CPT codes. So whether it's a home visit, a clinic visit, a nursing facility, ALF, right, hospital visit, whatever the codes that would represent where the patients would normally be seen with the location of service that the patients would normally be seen are still allowed with modifier 95. This provision of the waivers to telehealth delivery is set to expire next week. It is set to expire on July 19th. I checked this morning whether or not the public health emergency declaration has been extended, and as of 1:28 p.m. Eastern time on July 13th, it has not. So come July 19th or July 20th, the federal waivers will expire, which means that as it stands, telehealth will revert to its pre-pandemic federal requirements. That means a patient has to reside in a specific geography that is a healthcare shortage area, has to show up to an originating site that shares technology with a designated site in a physician practice. There will be more to come. I know that Fraser will and his directors will have an update once there is or isn't the expiration of this emergency, whether it's through email or another webinar, if there are some other significant changes. But as it stands today, come July 19th, that's the last day we can render federal telehealth services the way we're rendering them today during the public health emergency, right? And it is important to note that if you've been sustaining your practice through the use of telemedicine, right, that carte blanche exemption to patients being wherever they are, and you, doctor or non-physician practitioner, being wherever you are, does expire as of July 19th. Those are the general changes when it comes to telehealth as we see them today. Where you can go to check the public health emergency and its extension or not is phe.gov/emergency/news health actions, PHE pages default, right? But it's the public health emergency site set by the U.S. Department of Health and Human Services. Fraser, I just need a nod if you can see my screen because I changed the screens. Yes, okay, good. And if you click on the active link declarations of public health emergencies, right, it pulls up these. Right?
We actually cannot see your screen. We're still on the federal telehealth waivers page. There we go. Now we can see it.
Perfect. sorry about that. So this is set up by the U.S. Department of Health and Human Services, right? So this is a government website. If we click this link here, excuse my poor drawing capabilities, right? It refreshes the page. It takes us here. You can see that the date this was signed was April 15th. These are 90-day public health emergency provisions, right? So 90 days from April 15th happens to be the 19th. So this is where we will check, and you should be checking routinely if the public health emergency is renewed, right? So it's imperative that we keep on top of that, right? We don't want to be billing services that are no longer billable. If you have any questions, you can contact us directly. We don't have a problem answering those questions via email or calls, right, regarding telehealth. You can contact any of your local societies or Fraser's offices, right, and we're happy to help. But remember, we have just moved to a place where we are only able to provision the Florida prescribing authorities in the capacity that we were prior to the public health emergency. And from a federal perspective, we've got about another 5 or 6 days that we can continue to provide telehealth services the way we are today, unless the federal government acts and extends that. Fraser, anything else you'd like to share with the group?
Fantastic, Chris. Thanks for those comments. No, maybe just a thought around the commercial carriers. Obviously, the expiration executive orders don't really change what the commercial carriers do either, but just kind of a word of, or some words of advice for members considering what their commercial payers are going to do.
Yeah, so most of the commercial payers have been following in line with the national public health emergency allowances for telehealth, and they have been extending the same leniencies that Medicare, for the most part, has extended to the ability to bill, right, your commercial payers for telehealth. I can tell you that most of the major payers on their provider websites do have information that speaks directly to what they're allowing for telehealth, right? And because there are so many commercial payers, can't tell you what any individual one is requiring, right? But some of them have been in line and saying, yes, just use the 95 modifier. Some have said use some other form or fashion. Some have said we'll pay for audio only, but we won't pay for audio only synchronous, right, communications. So I would suggest that anyone check their commercial payers websites. They all have dedicated pages for this public health emergency and telehealth. Easiest way is to Google, right? Blue Cross Blue Shield Florida telehealth public health emergency, and it'll bring you to their site. But most of them have been in line with the federal waivers, and I would expect them to keep that practice inactive at least for the month. So while the federal waiver may expire on July 19th, most health plans follow monthly guidelines, so they would probably expire by the end of July. A good question, Fraser.
Fantastic. Thanks for that, Chris. Well, and as you teed up, certainly there'll be more to come as we wait to see if the federal orders will be extended or not within the next week. So certainly appreciate your time with us today, and hopefully we can continue to lean on your guidance and expertise on this and other topics moving forward. So Chris, thanks so much for being with us today.
Happy to be here. Thank you.